Good afternoon, everybody. It's really nice to see so many participants joining us today this afternoon. So I'm really heartened by the interest in this topic. So allow me to first share my screen. Just give me a minute. Okay, I hope everyone can see the slides that I have shared. Okay, so yes, as what Yue Peng has introduced me as, I'm a psychiatrist by training, and I do have a special interest in the mental health of the elderly. And dementia is something that I see quite frequently in my area of practice. So I'm really glad to be able to share a little bit more about this condition. And besides talking about treatment and stigma, I will also be covering some other aspects of dementia. So the scope for today's talk would include defining what dementia really is, the types of dementia that we know of, and the symptoms of dementia that one may experience if someone is having this illness, and how to go about diagnosing it, treating it, and some of the challenges that may arise for caregivers who are looking after patients with dementia. And I also touch a bit about on the community resources available for both people with dementia and their caregivers. And last but not least, I will also talk about stigma in dementia before Emily will then continue from there. Okay, so what is dementia? Dementia is generally defined as a neurodegenerative disease. People with dementia experience a decline in memory and other thinking skills that is severe enough to interfere with day-to-day living. And this is due to an underlying disease process that results in brain cells dying at a faster rate than normal, and it is not part of normal aging. You can see here a picture of a card view of a brain. One belongs to a person with a normal brain, while the other belongs to someone who has Alzheimer's dementia. So comparatively, you can see that the normal brain is much fuller and less shrunken compared to the other brain that is affected with the illness. So if you look at the dementia statistics locally, there was actually a study done in Singapore conducted in 2013. It's titled the Y study, which stands for Well-being of the Singapore Elderly. And through this study, it's noted that in this nationwide study, the prevalence of dementia in the elderly population, which is defined as people at 60 years old and above, was actually 10%. So that means that 1 in every 10 elderly persons has dementia locally, which is a very worrying number. And considering that our population is is aging, this number is obviously expected to continue to rise. And therefore, it's something that we should be concerned about, something we should pay more attention to and familiarize ourselves with. So dementia is an umbrella term that's used to cover many different sorts of dementia. The top two most common ones will be that of Alzheimer's dementia as well as vascular dementia. Other sorts of rarer dementia include Lewy body dementia, frontotemporal lobe dementia, as well as Parkinson's dementia. Now, moving on to the symptoms of dementia, it can be broadly categorized into three main sections. Firstly would be that of cognitive symptoms, and secondly would be that of functional symptoms, and thirdly would be that of behavioral and psychological symptoms. For cognitive symptoms, people with dementia may start experiencing memory loss, and that might manifest in the way of misplacing items very regularly, being more repetitive with their questions, in recent times. And some people might also start forgetting recent details from conversations that they have had with other people. Or even things like forgetting important dates, such as birthdays of people who are important to them. Some might start experiencing problems with language, with declining abilities to express themselves or understand what other people are saying. Some might experience difficulties with recognizing familiar faces or items, and some might have difficulties in performing familiar tasks, such as grooming or dressing themselves. And a few people might also experience some difficulties with problem solving and planning, such as making plans on what sort of ingredients to buy or groceries to buy, or how to go about with even cooking dishes that they are usually familiar with. Moving on to the second main category of symptoms, namely functional symptoms. It basically means that people with dementia might experience an impaired ability to carry out activities of daily living, such as cooking, coping with work, taking public transport, handling money or marketing, managing medications, or grooming, dressing, or bathing. And in more advanced severe stages of dementia, these people might also progress to having problems with controlling their urine or have swallowing difficulties as well. And moving on to the final section, which is common behavioral and psychological symptoms of dementia, it is not uncommon for people with dementia to experience some mood changes. They might become a bit more anxious or more depressed, given these cognitive decline that they have been experiencing. Some might also have some false beliefs about themselves, others, or their circumstances. So an example would be firmly believing that someone is stealing their belongings when they have in fact misplaced it. Some people might see or hear things that are not there. Some might experience aggression and more agitated episodes, and some might have more wandering behavior, meaning they might start going out quite aimlessly and sometimes even getting lost in public. There are a number who might experience sleeping difficulties as well. And also there are a few who might potentially experience a loss of initiative to engage in activities. A handful might also have disinhibition, and by that it means some socially inappropriate behavior, such as shouting loudly when in the library. Now, how do we diagnose dementia? It sounds like a really concerning illness, and is there some way we can go about to confirm the diagnosis? Now, unfortunately, there is no single test to determine this diagnosis, although I'm sure many of us wish that there were. It comprises of multiple levels of medical evaluation. So firstly, we do start off by taking a comprehensive medical and cognitive history. And this is really important, especially from the caregiver or the family's perspective, which will shed a lot of insight into the patient's function or decline in abilities. The next step will be to do a physical examination to look for any medical issues that the patient might be experiencing, and to conduct laboratory tests, including brain imaging, to look for any potential medical causes that may also mimic some symptoms of dementia. If all these are found, the medical causes will then be addressed first to see if it helps improve the patient's symptoms before definitively diagnosing the patient with dementia. How do we go about to get a formal assessment by a medical professional? We can always approach a general practitioner or a polyclinic doctor, so basically your family physicians in your neighborhood. If necessary, these doctors will then refer the affected individual to specialist services if needed. So specialists who actually who deal with such conditions are namely geriatricians, psychiatrists, and neurologists. And the million-dollar question, how do we then treat dementia? Although there's been lots of research going on, there is unfortunately no cure yet for this condition. There are, however, some drugs in the market that's available to help potentially slow down the progression of the illness. You might have heard of something called cognitive enhancers, which are basically drugs that target certain receptors in the brain to help potentially slow down the progression of illness. The usability of these drugs depend on various factors, such as the type of dementia, the medical profile of the affected persons, and the potential side effects that this medication might bring. So all these factors have to be taken into consideration before determining if it's a suitable option for the individual. Typically, the doses are start at a low dose before it's gradually increased in dosage according to the patient's ability to tolerate the drug. There has been also a lot of buzz about dietary supplements such as ginkgo, fish oil, that have been said to improve cognitive performance in people with dementia. Now, although I've heard lots of good things about the supplements, conclusively, based on scientific evidence, there is no conclusive evidence about these dietary supplements being useful in the treatment of dementia. Other drugs might also be used to help target the behavioral and psychological symptoms of dementia. So to mainly target mood symptoms or some of the distressing behavior that these patients might demonstrate. Examples include antidepressants, mood stabilizers, or sedatives. These are some ways to help manage the behaviors that such patients might demonstrate. But beyond drugs, more importantly, instead of treating the person as a collection of symptoms and behaviors to be controlled, person-centered care is the true principle behind the treatment of dementia. And by that, we mean considering the whole person, taking into account the person's unique abilities, unique qualities, interests, preferences, needs, and basically his past life history. By adopting a person-centered care approach, we will be able to remind ourselves to respect the individual and seek to understand his or her perspective based on his or her life experiences and evolving physical and mental health care needs. So this helps us to tailor our care plans accordingly and improve the person's well-being. So an example is that someone who was probably a seamstress in the past, who is currently having dementia, might not be able to engage very well in, say, model building activities, but might respond better to craft work or sewing activities. So these are some examples as to how we can go about in tailoring our approach to help the person live a more fulfilling and engaging lifestyle. Other ways to help manage this condition would include ensuring a healthy lifestyle for this individual by helping the person to maintain a balanced diet, having regular exercise, have good control of other medical conditions, especially cardiovascular risk factors such as high blood pressure, high cholesterol, and diabetes. Activity engagement tailored to the level of their tailored to the level of their abilities is also crucial for regular cognitive stimulation for the individual, so as to reduce as much as possible the progression of the illness. Having a supportive social environment would be helpful in enhancing the person's well-being as well. And by engaging in appropriate community care services, it can help improve the social care support that the person receives and the person's family as well, the support that the person's family receives as well. Some community resources for persons with dementia include Alzheimer's Disease Association. They have a lot of information about dementia and is basically an organization that supports persons with dementia and their carers. They have programs and daycares for persons with dementia, and they also provide caregiver support training and counseling as well. I've placed on the slide the website as well as the dementia helpline, and you do feel free to explore the website and get in touch with them if you're keen to engage their services. All right. There are also other forms of community resources for persons with dementia. Family service centers, which are very conveniently located in every neighborhood, can help to link up clients to appropriate agencies in the community. There are also befriending services that can conduct home visits and provide company for the more isolated elderly. Home-based services are also available, such as medical and nursing teams, to help carry out some of the care care at home for such persons. And senior activity centers and daycare centers are also services that are available to help care for the elderly and engage them in activities in the daytime. If you're curious about these services, you can go to the Agency for Integrated Care website, www.aic.sg, that oversees basically all the community resources that are available. Being a caregiver can be very stressful, and this can be even more so in those who are caring for dementia. More often than not, it can feel like there are multiple roles that the caregiver is struggling with, and it's not unusual for them to experience lots of challenges. Some of the challenges include not being familiar with the disease, not being familiar with navigating through the healthcare system, not being familiar with community resources that are available for them. And as a result, sometimes caregivers might have an affected work and personal life. They might experience physical and mental exhaustion as well as financial burden. And I think it's important as caregivers to recognize that it is normal to feel angry, guilty, or even anxious in times of caregiving. What is important, however, is to learn to recognize that you are feeling this way and that you need to learn to care for yourself in the midst of undertaking your caregiving duties. Some tips on self-care include taking time out away from caregiving duties, learning more about the illness to improve your understanding of what the person you're looking after is going through, sharing problems with your friends and families and obtaining support from them, and also learning to engage with community services such as what I've mentioned previously to help support your caregiving journey. And last but not least, you can consider joining a caregiver support group as well to see to share the challenges that you face with people in similar positions. Similarly, there are community resources for caregiver support, and these resources can help provide advice and support through consultations and trainings and programs. Alzheimer's Disease Association, as I mentioned before, is one example of such a resource, as well as family service centers who can help link you up to the appropriate agencies. But as difficult as it may be, the caregiving journey can still be a very rewarding one. Bonds can deepen through care, companionship, and service. And the caregiver's problem solving and relationship skills can also grow through the experience of providing caregiving for the loved one. There will also be new relationships formed through education and support in your caregiving journey. I have now come to the last section of my talk, and I'll be talking briefly about stigma and dementia. So what exactly is stigma? Stigma is basically the use of negative labels to identify a person with an illness or disability. And it's unfortunate but a very common occurrence that stigma in dementia is happening. Examples of stigma include describing someone with dementia as being abnormal, difficult, or problematic, or simply brushing it off as a normal aging process instead of recognizing it as an illness that requires intervention. And there are many negative implications when it comes to stigma and dementia. It might prevent people from receiving help, from getting an early diagnosis, seeking treatment, or living the best quality of life possible. How can we help to overcome stigma of dementia? Now, I really like this set of tips that were provided by the Alzheimer's Association National Early Stage Advisory Group. I think this is in the UK. They comprise of some members of this group comprise of people with also early stage dementia, and they've come up with this set of tips, which I thought was really applicable to many people, to us, to help overcome stigma. So firstly, be open and direct by engaging in discussions about dementia and the need for prevention, treatment, and eventual care. It's important to share accurate information, facts, to dispel misconceptions that other people might have. Remember to stay engaged in meaningful relationships and activities so that you get sufficient support for yourself. And do not be discouraged in the event that people are not swayed by your attempts to help educate them. The denial of diagnosis by other people is not a reflection of who you are, but do continue to be part of the solution by helping to raise awareness and advocate for support and research. Now I'd like to pass the time on to Emily. She will be sharing very interesting experience firsthand about what is it like to live with dementia. So thank you, Emily.
Yeah. Yeah. Hi, everybody. Good afternoon, good morning, good evening, wherever you are signing in from. And well, thank you, YP, for inviting me. And he is actually helping me to do the clicking because I won't be able to multitask and talk at the same time, focus at the same time, and click the thing. Yeah. So it's a privilege to work with the Bribe Center. A little bit about me. I'm Emily Ong, and I I used to work as a learning consultant dealing with children that have learning disabilities. So I work with the parents and the school also. And by training, I'm an early childhood educator. So I, other than teaching in preschool, I'm also a preschool trainer. And then being a parent, I'm very passionate about believe strongly in parent education, and also I very active in as a parent educator until now, you know. And also I'm a what you call a volunteer and continue to be a volunteer. I do visit school and helping out with some of the special needs thing. And but most of all, I'm a dementia advocate and living with mild cognitive and impairment and a young onset dementia. Next slide, please, maybe. Yeah. So I have been actually living with a cognitive decline for several years, and now before even my diagnosis, which was 2 years ago. It didn't cross my mind that I might be experiencing the beginning sign of cognitive impairment when I was in my 40s. Now we always assume that as age comes, with age, it comes with decline in memory and cognitive ability. Yes, we might not be as sharp or as quick like what we were in our younger days. But in my case, is that I could sense the gap difference in my cognitive functioning. I started to make more errors, that I would not have made previously, and I have more and in my conversation because I cannot seems to find the words for what I want to say. This initial stage is called subjective cognitive impairment, which can only be felt by the person in concern, and others around the person will. It's very hard for them to notice the difference because at this stage it is so subtle that the gap can be compensated with strategy. That's why my family members also have no idea that I experienced it. Of course, it will make a big difference, if society, including GPs, are more aware of subjective cognitive impairment and the possibility that it might be an early indication of cognitive decline, even if the normal cognitive testing is not able to pick it up. And now it was only when I was not able to make the French toast, as shown in that picture there. That photo is one of the many, because I love cooking, so that is one of the many breakfasts that I serve my family members. So it was a French toast incident that triggered that something was definitely not normal. And it was my first brain blackout episode where I call it my brain freeze. There was no recollection that I had ever met French toast before. even though I had been making it since my girls were toddlers, and now they're in their 20s. I guess you can equate it to when your computer crashed. There's totally nothing that it can be retrieved, and it was just blank and not black like that. So ever since then, I do experience such episode, but it varies in intensity and duration. And like sometimes I will have a list of things that I want to buy, and this shopping list is inside my phone. But when I arrive at the supermarket, I just cannot remember why am I there, and so I sometimes I just that the brain just cannot think that, okay, just refer to your phone, you have the list there. Yeah, so it just freezes and doesn't know how to function. So it can happen anywhere at any time and on anything. Yeah. So next slide, please. So getting a diagnosis for cognitive decline is extremely hard when it comes to younger people, probably because society as a whole still lack that awareness that young people equally can have cognitive impairment. I was misdiagnosed despite failing my Montreal Cognitive Assessment 3 times, progressively worsened over half a year plus, like that, from 24 upon 30 to 17 upon 30. 16 upon 30 is, you can consider, is Alzheimer. So being young and females, some more, have that added layer of misconception that ladies, female, being female, we are generally more emotional, easily depressed, overly worried, and anxious. So it's very hard for you to really put your point across to your doctor. So I was treated for mood issue, and I was put on benzodiazepine to treat my insomnia. It was I would say that medication is the most scariest side effect from medication I ever experienced, because it really turns me into a living zombie. I practically have no idea of who I am, So I was diagnosed with neurodegenerative disease, but not cognitive impairment. It was fatal familial insomnia. It is a very rare prion disease. I was told to get my life sorted out, stop working, and learn to get used to being taken care of. My family was advised to get a live-in maid, a full-time, to take care of me. And for safety reason, I am advised not to cook, not to bake. It was the most nightmarish part of my life. I gave up everything for almost a year, living aimlessly and fearing for the worst to come. When I was diagnosed with mild cognitive impairment and with possibility of young onset Alzheimer, I think should be 2018, I think somewhere around like that. I experienced a range of emotion. It's a shock, because not dementia, I just couldn't believe it, because it's like we were associated with all people. And then there is this sense of fear, helplessness of what lies ahead when you have a disease that has no cure, and there's so little thing that is available, for support and things like that. A sense of relief also for myself and acceptance, because all this time I have been saying to the doctors that, hey, I am not don't have any depression. I don't have any mood swing. I'm definitely not having any kind of emotional problem. But to know that now, the diagnosis really confirms that yes, I am right, and all these changes I experience in my cognition, start to make sense to me. And while you are trying to digest all this news, it is without doubt that you and your family will be grieving for the loss concurrently, and the loss of the future you work so hard for, and the loss of a partner, and a parent that you have known so far, and the loss of an income. Furthermore, dementia is a highly stigmatized condition, and it is associated with all people. So it was emotionally very tough on me to 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 accept it. While I do, logically I accept it, but emotionally it is very difficult. I was not sure how to explain to my mom. My mom is in her mid-70s and cognitively sharp, you know. Until to this day, I don't really think my mom is able to fully comprehend that I have young onset dementia. She just take it as a kind of brain disease. So anyway, that's fine for me. I was and still am very concerned how my condition will affect my family, and especially with the stigma surrounding dementia. Hence, I always keep them out from my advocacy life, even though they are my very strong supporters in the background. I don't want people to walk up to my husband or my children and ask them, hey, can your wife or your mother still do this and that? It is already very tough on my husband because there are things that we can no longer able to do. And it is equally tough on my children because this used to be a super mom. I used to be a super efficient mom. Now I had to count on them for many things, and I need to be reminded on every little things. So that is very, very tough for the whole family. Next slide, please, YP. Now, living with a neurodegenerative disease like dementia is more than just losing memory, as what Dr. Tan just now earlier had shared with you. It affects multiple aspects of our cognitive abilities as well as social abilities and our behavior, and that changes significantly interfere with our daily life functioning. There is not a single day where I wake up without feeling thankful that I can still recognize who is who, and that I have another beautiful day to live life to the fullest. Why? Because we never know how functioning we will be from day to day. Someday I'm so efficient that I'm just like me in the past. But someday I struggle, to put words together, like as if the different parts of the brain are doing their own thing and there is no communication. You can say a silo departments up there and they are not talking to each other. So there are tons of example I can give, but I will touch on a few to show the struggles I have and how sometimes I am terrified to be out in the society, even though I want so much to normalize my life. I am not good at reading social cues now, and measures like social distancing and standing within the lines on the floor can be tough on me if when I'm out on my own. There was one instance where I was misunderstood as jumping queue because I was not able to logically, understand that that person was actually in the queue, even though she was not directly behind the person in front of her. she was on the phone, and I stepped into her spot. And the next thing I know is she was shouting, and everyone was looking at me. It was terrifying moment because I didn't know what have I done. I apologized and I just walked away from the store. I didn't buy anything. It was only when I arrived home in the quietness, I tried to understand and process what has just happened. And it was only through that quietness then I realized that she misunderstood me as I jumping the queue. But will it make a difference if I were to identify myself as a person living with young onset dementia? I doubt it, because the awareness is seriously lacking still in our society. Now, signage hanging way above the head, wordings, arrows are of little help actually for me in guiding me to navigate my ways around in the mall. The same goes for verbal directions and instructions. If you just to tell me, oh, you walk there and then after that you turn left and then turn right, go straight, and then this really makes no sense for me. There's these examples as I was one day on my way to KTPH from my place to KTPH to do a sharing with a healthcare professional. So I was able to take train from my place all the way to Yishun MRT. And normally is that from the Yishun MRT, I will walk to KTPH. Not above ground is easier for me because there is lots of landmarks for me to navigate my way. But that day happened to be drizzling. So I said, okay, since I cannot walk on the ground level, I will use the bus to go. But then the issue is that I forgotten that I have never taken a bus from the Yishun bus interchange, And so when I arrived there, as you know, the Yishun bus interchange is very busy and noisy. And it was really in a state of confusion for me. I just very, very lost. So I managed to find a counter whereby there are staff standing at the mending the counter. I think there is 2 to 3 of them. And then I walked to them and I asked them, is there a bus that can take me from here to KTPH? Then they said, yeah. So they give me the bus number. Then I said, where is the place you can take this bus, the platform or the best place? Then they just said, oh, they just give me the number, and then they just say, oh, you just walk straight like this, Yeah. So, and then so I told them that I'm very lost. I will need help. And but they were very busy doing their own chit-chatting and things like that. So they gave me a kind of look like, are you for real? Because I don't look old. I don't look like an old person or a person with handicap, right? So then after that, I just make my way and I slowly find the bus, where to take the bus. Yeah, I managed to arrive at KTPH and slightly behind a bit. Yeah, but I managed to still do my sharing and so it still ends up to be a good day for me. Yeah. So, but during the time I was sitting in the bus, it was really a struggle for me, to pull myself together, because my anxiety was, is there already. So I really try to, calm myself down so that I can still do the sharing. So if you were to look in the eyes of the people when you hear me saying this, you will say that, wow, it really sounds like you are suffering. And that's why many people now, people living with dementia are often referred as dementia sufferer. But I like to ask you, do you think we are suffering or are we struggling? To me, I believe that we do struggles when the society is not able to help us when we need the help. But definitely we are not suffering. Yeah. So the other one that I want to share is when passing sound. Like for example, in this slide, I put the kettle whistle, and I used to use the kettle that is boiled water over the stove. So when the kettle met the whistle, I not able to link it that the whistling is meaning the kettle is boiling, and so the water has boiled and you have to go and off the stove. I just take it as a passing sound. So that is also when it means when I cross the road, yeah, I will really need to find a zebra crossing, because I definitely cannot just cross the road like that, but you cannot find zebra crossing in not every places, only on big roads you have zebra crossing, but among the small road you don't have zebra crossing. So the problem is that the sound and honking and things like that, sometimes it does not register that the car is very nearby already, please don't cross. Yeah, so I do have that problem. Next slide, please. Yes. So many of us have learned to live and cope better when we adapt living in the present, one day at a time. If you think too much of what the futures hold for you, it can really consume you, and you will find yourself sucked into the whirlpool of despair. You need to embrace the change and decline, because that is something inevitable. We can do whatever we can to slow down the progression, but we cannot stop the decline. When you resist the changes that dementia brings on, you will find that life is very meaningless, and you want to have nothing to do with dementia, and that including getting support and help. I know it is hard to live positively with dementia when stories and media again and again depicted that the doom and gloom of dementia. To me, dementia has taught me that it is all right to take your time to do things, slowing down. It's not a bad thing, and because you sort of become more mindful of every action that you do, your body do. You become so, I have been practicing meditation since I was a very small child, but I never really understand the mindfulness until I have now living with dementia. That the condition forced me to slow down. And when I slow down, I become very mindful, not meaningful, mindful of every little thing. I start to appreciate life so much, the quietness, the chirping of the birds at my, the window there, and also, you know, the smell of the food, the spices and things like that. I takes the time to appreciate things. So it takes dementia to taught me what is, what is mindfulness actually. Yeah. So I'm a bit lost on track. So let me continue. Now I also learned to walk around without any purpose. Last time when I said I go for a walk, I know why I go for a walk and things like that. But now I just go for a walk. When my husband invite me, you want to go for a walk? Yeah, I will just go for a walk. Anyway, you want to go? No, let's just go, just walk, and there is no destination and things like that. But for many people, it will be called wandering, it is called a wandering when it's anything related to dementia. But it's okay. You no need to have a destination or a goal. You just walk. So, and then another thing that dementia, the condition had taught me is that be brave enough to do whatever that you want to do. You don't need to wait until you perfect everything, because when you live with dementia, there is no such kind of thing called perfect. So I discovered that I'm quite good in writing, and when I'm given the time to do so. So I no longer so worried about my language problem, my grammatical problem, and the mistake that I tenses, confusion, and things. I just write, and 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 I found that I'm so pleased with my write that the response that I get from the people who follow my Facebook page. And to see that the increasing numbers of people following me from all over the world, that really motivates me. Yeah, so it's not all doom and gloom. There are beauties living with dementia. Yeah, next slide, please, YP. Now, however, the social stigma associated with dementia can have a wide-reaching and lasting consequences on how we experience living with the condition. For instance, you will often hear, "Don't know lah, my mama is such a picky eater," or "You don't know anything. You cannot even remember what was just said to you." No, whenever I hear this kind of thing, I touch my heart. I say I am very blessed, very fortunate that my family, no my close friend, ever define me by BPSD, which stands for Behavioral Psychological Symptoms of Dementia. It is very painful to live life when others stop seeing you as a person, and your self-worth is reduced to mere symptoms of the very condition that you are living with. It really tends and devalue a person's social status and sense of self. Many families, because of this, prefer to keep their loved ones at home to avoid embarrassment from dementia symptoms, the fear of accident, like what I experienced in the outside, and to difficulties in negotiating social barriers. Behaviors like wandering, pacing up and down whenever we get a bit stress or a bit boredom, we do pace up and down, and shouting and anxiety, resistance to take bath, which is normally cited, are often not taken as distress, cry for help, for understanding, or unmet needs. Instead, persons living with dementia are homebound, okay, and even physically restrained. And I'm not going to talk about being medicated, sedated also. So I am very certain everyone could identify with the social isolations and housebound during the COVID circuit breaker period, and even during the current situation whereby we had to check in and check out measure whenever we visit any places. So in Singapore, the National Care Hotline has seen a surge in the calls by the end of April, and about 40% of the 6,600 calls were channeled to trained volunteers to administer psychological first aid. According to the news reported in the Straits Times, this prolonged CB measure could have an impact on mental health, and this psychological effect that come with social isolation, boredom, resistance to stay in, okay, and family tension because everybody is in the house, increases anxiety and distress. And the funny thing is that everyone is able to recognize that and take this as normal human response to fear and to fight situation. No one labeled this as this psychological behavior as behavioral psychological symptoms of COVID-19, a term that is coined by my dear friend and fellow advocates from Australia, Kate Swaffer, and I have had to thank for that. The next misconception is assuming that person living with dementia is somehow incapable, and often their independence are taken away because of safety reasons without considering the individual capacity. Take, for example, when I was diagnosed with mild cognitive impairment and the possibility of young onset dementia at the age of 51, I found that my social circle immediately shrunk and friends hardly contacted me. I thought letting them know of my condition would make things easier for them and myself, but I was 100% wrong. I tried to initiate conversations with some of them, but I could feel that sense of apprehension and uneasiness in them. We no longer chat or laugh about familiar topics, and our conversation was kept to very basic, like how are you doing? Are you okay or not? And that's it. You know, it is like this friend of theirs suddenly become incompetent to even handle conversations. Or they might be so fearful that now that I'm living with dementia, I have no capacity to handle things if they were to say wrong things to me. Hence, you get friends trying to console you in their perspective is consoling by telling you, no lah, you cannot have dementia because that is what my grandma is having. Or yeah, part of getting old, I also forget things every now and then. Or even better still, make a joke out of dementia. Hey, you know what? I think I'm getting dementia too. They thought that they are being kind to me by making me feel good, but actually they are not. They are not realizing that their kindness is patronizing. This this empowering attitude and treatment towards person living with dementia, whether is it done out of good heart or not, is equally damaging to the psychological and emotional well-being. When I was told to give up my work, my cooking by the doctor for safety reason, okay, that is for in good heart, good. I felt my world collapse. My basic human rights were taken away without even asking me if that is all right with me. Is it that what I want? Or do I feel confident of my own ability now? They just assume that that I'm okay with it. Whatever you people decide for me, I'm okay. But I'm not okay. Many individuals living with dementia that I come to know in my advocacy work with ADA experience self-stigma because of these repetitive negative beliefs, attitude, prejudicial belief of incompetency, and stereotypes related to dementia. Cognitively and emotionally, person living with dementia began to subscribe to this negativism, which can lead to depression and then avoiding coping, social withdrawal, even to reach out for support group, low self-esteem, hopelessness, and worsen psychiatric symptoms. And then when they have psychiatric symptoms, they are treated with all these drugs and things like that. And then people will say that, see, crazy people. So it's very hard to live with dementia, frankly, because you need to please the society also. This public stigma and self-stigma really lead to exclusion from meaningful living. How to have meaningful lives when you are seen as incapable in every way, and that everything has to be done for you, and you live your life like a puppet. Yes, like sometimes I felt that when I see other people who are living with dementia and they cannot basically do anything, I feel so sad. So sad, really. And that is why that gets me to become an advocate, actually. Next slide, please, YP. I cannot deny every day can be a new set of hurdles for me to navigate. I take 2 hours to prepare a simple 2 dishes meal. You know, it's just 1 veggie and 1 protein for my family, that you or me in the past can get it done within 30 minutes, not from preparing to cutting to cooking and put it on the table. But that doesn't stop me from cooking for my family, as I always do. I organize and line up all my ingredients for each dishes and then rehearse the flow before I cook each meal. Yes, a lot of effort put in, yeah. But then retaining that role of being the home chef is about normalizing my life living with dementia. However, a person's overall experience with dementia is not limited to how cognitive impairment affect their functioning, but also the stigma, as I have gave so many examples already related to dementia. Whether dementia unites or divides a family depends heavily on how the society see and talk about dementia and treat people living with dementia and their families. You have a choice to make, see us with dignity or define us by dementia. Both are letter D, but one is empowering, the other is eroding a person's value to nothingness. So my message to you is embrace dementia, sensitivity, and compassion. You can help by putting an end to stigma by treating us as a person with dignity and respect, address us as person with dementia or living with dementia, recognize that we are experts in our own unique condition, and thus ask us what we think is best or doable for us. Next slide, please. My hope and my advocacy is not just about to raise awareness, but to ask you, the audience, whether are you care partners, care carers, healthcare providers, service providers, policy makers, researchers, or so forth, have a conversation with us so that you know more about dementia, involve us so that you can see that we are still so able. Include us, including our voice, and let us lend our lived experience to make inclusion better for everyone. Next slide, please. Right. Thank you for your time and listening ears. Thank you to my daughter for helping to put my thoughts into the slide, because without her, I won't be able to do these slides. Thank you, YP, for rehearsing with me. I appreciate a lot. And then, of course, thank you to Graham for allowing me to use his song at the beginning of this, before the session starts. If you want to find more about what I'm doing, you can follow me on my Facebook at Living with Mild Cognitive Impairment and YOD. Thank you.
Thank you, Emily and Dr. Tan, for the sharing. It's very timely reminder that we are reminded about person-centered care, about treating persons with dignity. And if they are a part of the conversation, we can learn so much more. So for example, we were just in conversation with Emily 2 days ago, and I think Emily was sharing about, or rather I asked her about her Facebook post. She shared with me about her hand. Emily, you want to show them your hand?
Yeah.
And so if I understand correctly, because of this loss of being aware of what's going on with your right hand, even though it was injured, you kept on using it. Am I right to understand that?
Yes, correct.
Emily?
Yes, correct.
Yeah, resulting in it being quite injured. And so I remember reading that Facebook post, and she said that, oh, it took her 30 minutes to write that one paragraph with that one hand. And my reaction was, wow, when I look at that and I look at all the posts, I think about the pain that Emily might be going through. But it's very inspiring to see how she is not suffering. And so that was really my big learning point from speaking with Emily. I want to open the floor now to questions. We have 2 questions and I'm going to go through them. The first is from Cheryl. She asked, what would be your advice or alternatives for elderly who are resistant to attending daycare due to his introverted and reserved personality? I'm going to share my perspective on this first, and then we go to Dr. Tan, perhaps. I think what really matters here is person-centered care. Sometimes it takes patience, sometimes it takes understanding that person's needs. I know of a colleague in Brown Center who was working with a patient with dementia. So this patient is slightly older. And by really paying attention to his needs and what he wants, eventually he got that person to take a look at what daycare was, get interested in it. My colleague helped find a buddy for this person. So it was very creative strategizing. And eventually this person, who was not very keen on going to daycare, as are many people, didn't want to stop going. And so it's one of our success stories where we help to stabilize care for a dementia patient. And so my response to Cheryl is to work with a community care provider, to work with compassion, creativity, and care, and to keep learning more. I also want to ask Dr. Tan for perspectives on this question.
Yes, actually, you've actually just said whatever I wanted to say. Yes, the principle behind referring, say, someone with dementia to daycare is the idea of giving the person sufficient social cognitive stimulation. But we also have to recognize that daycares are not something that everyone is open to. Can't really force someone to socialize if the personality is not as such lah. But that being said, some people might respond to a more sort of creative, gradual approach. You might want to consider bringing the person down to the center to have a look, just have a vibe, a feel of the vibes of the center. Some people might take well to a trial period first before agreeing to deciding whether to continue with the daycare placement. And some people are just not keen on daycare. And I think that's when we can think about bringing these activities, the principles of regular stimulation, cognitive and social stimulation, back home instead, by finding ways to engage the person at home with activities that are tailored to his or her abilities. From a more professional perspective, if you are really not sure how to go about with that, you can consider speaking to an occupational therapist who's trained in dementia care, who might be able to give you some insights as to how to tailor some activities to the person's abilities. Yeah, so that's my 2 cents worth.
Thank you, Dr. Tan. Emily, is there anything you would want to add to this question on daycare? Do you have any insights on this?
Daycare. I have not been to any daycare. Yeah. Well, basically is that for me is if the person is not comfortable to go to the daycare, I think it's good to respect that person first. I mean, I'm coming from a person living with dementia. If one day I really need a daycare service, I want my family to respect me first. Yeah, and when I'm ready, and then you take me there.
Yeah. Can I just add on one more point? I think the other thing about dementia, it's such a unique illness because it spans across a severity range from mild to severe. So really, it depends on the needs will continue to evolve as the disease progresses. So we will have to keep evaluating and see whether at what point is it appropriate to refer someone to such a service, a daycare service. So it's not a straightforward answer as to we just have to put you in there and that's it, you know. We have to keep evaluating and evolving with person-centered care in mind.
Thank you. The next question is, what can be done to support emotional well-being, maintaining a sense of dignity for persons living with dementia? Maybe we can start with Emily, then we go back to Dr. Tan.
Okay. May you please, YP, can you repeat the question? I'm lost already by the time you say finish.
Sure. So the question is, what can be done to support emotional well-being and maintaining a sense of dignity for persons living with dementia?
Okay, yeah. Well, I can tell you and share with you my perspective of how I do it with my family is that whenever there is anything that involving the family, they will ask me, you know, for my views of what I think. And of course, I will take a very long time to process, and then I will, sometimes they will ask me, I say, okay, maybe I come back to you tomorrow. And not that tomorrow I can come back. Like, if they don't remind me, I cannot come back. So that is a way of respecting me as a person, and that I still have a part to play in the family. And then they will sought for my opinions, and that by itself is very emotionally very positive, that I am still needed as a family member, and I'm still able to contribute. All these are part and parcel of a person's dignity. The dignity disappears the minute when the person have no right to say anything. Everything is meant for the person. That is when the dignity is gone. Yeah.
Thank you, Emily. Dr. Tan, would you like to add to that?
Yes, thank you. I think the idea of maintaining dignity in people with dementia is to basically recognize the person beneath the illness and always making a conscious effort to do so, acknowledging that there are feelings that can occur regardless of the severity of the stage of dementia, and acknowledging that these feelings are there. So sometimes it's a struggle as carers, having to balance between the practicalities of care and allowing the person to kind of go about making decisions or activities that in their daily life. So it all boils down to having to have that sort of balance between person-centered care and also knowing when is appropriate to intervene, in a sense that it ensures the person's overall well-being is still at least cared for.
Thank you, Dr. Tan. We have a comment about daycare from Siu Hong. Thank you for sharing. And she says, bring the person with dementia to view the place and seek permission from the daycare center to allow him or her to see the activities carried out. I managed to get my mother to be at daycare center, and she enjoyed it so much that every day by 7 a.m. she was prepared to go to the center. Thank you very much for sharing that. That's a useful suggestion.
Thank you, Siu Hong.
Before we get to the next question, I just want to invite, if any of you would like to ask a question verbally, you can raise your hand. So you click on the raise hand function in your Zoom platform. It's right there in the middle of your bottom, on the bottom part of the app. And then we will allow you to talk, and then you can ask a question verbally. So the next question is just to confirm whether mild cognitive decline, or MCI, and dementia, can they be completely different things, or are they the same?
Shall I take this question?
Yes, please.
Okay, so mild cognitive impairment is not the same as dementia. You can see it as mild cognitive impairment is not so severe to the point that it interferes with, the cognitive symptoms are not so severe to the point that it interferes with daily living, whereas in persons with dementia, the symptoms are severe enough to affect independence in carrying out day-to-day activities. So they are different, and there is a distinction between the two. For people with mild cognitive impairment, MCI, some of them may continue to just remain at having just MCI. Some might progress to go on to develop to have dementia, while some might actually revert into normal cognitive status. So the jury's out as to how it might progress. So it's important to try to minimize risk factors for progression to dementia as far as possible.
Thank you, Dr. Tan. While we wait for more questions to come in, if there are any, perhaps I could ask a few questions to get the conversation going and the time we have left. So I really want to ask Emily, how did you manage to take the suffering out of the picture? Because it's something very inspiring for a person without dementia. It's inspiring for all of us. How do you take the suffering out of your life?
Okay, yeah, like what I say is that I don't see it as a suffering, but as a struggle, because suffering would say that I will be in constant pain, I will be crying all the time. Maybe I imagine, maybe that's how I see suffering is. Yeah, but for me is I see it as a yeah, there is struggle. Yes, like for example, I share with you, I had to take so long just to prepare a 2-dish meal. Yeah. How I do it is that one thing is you have to go through the grief. Grief is very important, the grief period, to really acknowledge your own feeling, how you feel about it, and then learn to accept that you will never be the same again. But that doesn't mean it's the end of the world, because our brain is such a beautiful thing. It might not be functioning at the full capacity, but it definitely have not given up on you, right? I mean, it didn't die. It just said, "Hi, I'm not that okay," Yeah. So you work on it and you find ways around. And what I do is that, like what I share with the parents who have children who have special needs, I always say that celebrate every milestone. Every milestone you celebrate, and be happy at the moment. The minute that you can do it, you celebrate it. You don't need to wait until the one day, the very big thing, because that one day is hard to come by, and because our cognitive decline fluctuates, not only just decline, and so what I do is that, like just now the French toast one, whenever I cook a nice food or bake a nice thing, and I feel so good about it, what I do is I just take a photo and post it on my Facebook, and not to show off, but to show off to me, to myself, that and reminds me whenever I feel down, I will go back and look at the photo. Yeah, I can do this. You see, I made this one, but now I cannot make. Okay, never mind. Let me create another thing. There's a lot of things of food that I post on my Facebook. I not able to make anymore, and it can be not long time ago. It can be as recent as just few months ago, but I'm not able to remake the same thing. So what I do is that I look at the picture. I know that I have a good celebration of it, so I feel happy about that, and I move on. I move on and look for new things to cook, to bake, to make myself happy again. Yeah. So I have this motto in me, which I share with the parents with special needs, and they all love it. And even the Ministry of Education, those officers who work with me, they always quote that. Emily's always have this saying, you always celebrate every milestone and be happy with the present. Whatever that you achieve, just be happy. And if you are sad, you acknowledge that sadness, because that is real. That is how you feel. Don't feel bad if you feel sad or you cry. Just cry it out. And then after that, get up, pick up yourself up, and do something that makes you happy. Yeah, that is life.
Thank you, Emily. Very wise indeed. Can I just ask you, does exercise help to improve your overall well-being?
Yes, exercise. Yes. Okay. I share with you. Since small always practice meditation, and of course I never really understand the meaning of it until now. I'm living with dementia. What is the meaning? The real meaning being, being mindful. And so that is very important. Has some moments of quietness, just you and yourself. Because living with dementia is one thing. It's very tiring because we have to put so much effort just to do the everyday thing. For us, the minute we wake up until the time we go to sleep, I think we burn more calories than we actually consume the calories. That's what I always told my family. I think I burn more than actually I consume because the brain had to work so hard and not just to do the same thing, not even doing some invention or one. It's just basically to get through the day. Yeah. So yeah, have some quiet moments for yourself every day. You can sign up with the brain center and do some mindfulness practice. Yeah. And then exercise, have a mix of exercise. And yesterday I was attending this Duke and US Sing Health talk, and they mentioned about this mixed exercise, which I'm very happy, which is something that I really promote. Is don't just do one type of exercise, mix exercise. And that means that you have strength training, and you do your flexibility, and then you do your aerobic, and then after that, and now you do your walking. Why is that? Because I found that different exercise somehow engage your brain somehow differently, even though they are all motor, right? But somehow I always feel that whenever I do this exercise, somehow certain part of my brain is a bit more energized than the other part. And then I do another type of exercise, another part of the brain is more energized. I don't know, maybe that is my feeling. But that is how I feel. So I always have a mix. And so yesterday when I attended the talk and who is that? Who I cannot remember the special the therapists that specialize in exercise one said that you must do a range of exercise, a mix of exercise. Then I said to myself, yeah. Another celebration. Yeah,
Thank
of
you,
course,
Emily.
other than exercises, you must eat well. Your nutrition is very, very important. Yeah.
So I think we have someone who may want to ask a question. I think I'm going to allow you to ask your question now. So you can unmute yourself. Okay, while we wait for that to happen, okay, we're just going to go through these remaining questions quickly in the 6 minutes we have left. So another question is, how do I bring my mom for a dementia assessment if she refuses? There were signs of delusions and confusion. Maybe we can start with Dr. Tan.
Hi. Yeah, that's tough. I think probably one point of contact would be a family physician first, maybe as part of her regular checkup for her other medical problems. You can flag that out to the doctor and see if from there they could do a simple assessment to see if there's a need to refer her on to a specialist service for further investigations. Yeah, that could be a point of contact.
Thank you. The next question is, how do we tell the difference between MCI and dementia?
I think we covered that earlier. So MCI is basically different from dementia in a way that the decline in the symptoms are not sufficient to impact on day-to-day activities, whereas for dementia, people with the condition will experience difficulties in coping with their day-to-day life.
And on a related note, how do we prevent MCI from progressing to dementia?
That's a great question. So in a similar way, it's basically adopting strategies to to reduce your risk of getting dementia. Risk factors for progression to dementia include smoking, alcohol intake. So trying to reduce all that would be very helpful. It's also important to make sure that you have good control of all your chronic medical illnesses, such as high blood pressure, cholesterol, diabetes. And last but not least, maintain a healthy lifestyle. Make sure you have balanced diet, regular exercise, and don't sit in front of the TV just to watch shows all the time. Try to engage in mind activities. Some people love Sudoku, some people love doing craft work. So it really depends on what you like, but do make the effort to engage in these activities to exercise your brain a little.
Thank you. The next question is, can dementia get worse suddenly? And what is the lifespan of a person with dementia?
Okay, probably I'll answer the first part of the question first. If someone is having dementia and the symptoms suddenly take a turn for the worse, I would be very careful in terms of evaluating the person for any new medical issues that the person might be having. There is a condition called delirium, which is basically an acute confusional state, whereby someone gets say a new infection or maybe some problems in the salt levels in the body that can tip the person over into this acute confusional state called delirium, and that can manifest in the form of a sudden deterioration of dementia, which is not actually truly the case. Yeah, so in such instances, bring the person to the doctor, get him or her evaluated for possible delirium, so that medical intervention can be conducted if needed. This is a potentially reversible cause that can help, that can be treated to prevent the person from deteriorating further. With regards to the second part of the question, the lifespan of people with dementia, honestly, there's no clear-cut answer because it very much depends on the type of dementia and the medical profile of the person. But generally, for people with, say, Alzheimer's dementia, it usually the illness is quite a long chronic one, and you might see the deterioration progress over a couple of years, say about a decade or so.
Thank you, Dr. Tan. Let's take the last question. This person asks or says, my mother keeps losing her personal things and is not interested in doing anything anymore except to eat and play mahjong with her family members. How do we help her to get out of this? Maybe we can change things up a bit. Emily, do you want to share something first and then we close off with Dr. Tan?
Yeah, okay. Yeah, well, if your mom can play mahjong, I think that is very good. That is keeping her entertained and play mahjong. I know that even though I don't play mahjong, you require people to play with you. So while you play, you have excitement, you have socializing also. I think that is a very healthy thing. But of course, you might be worried that your mom only do that thing. Well, maybe you can start to introduce some other things that is, very similar to the mahjong. Why does she likes to play mahjong? Maybe she is a competitive type, or maybe she is a type that, who likes to have that, what you call that kind of social circle, but not too big social circle, but just a comfortable size. So, trying to find the why she likes mahjong, and then you find another activities that carry that more or less that similar characteristics to that mahjong thing. And maybe, who knows, your mom will pick up another thing. Yeah, it's not mahjong, but it has the mahjong likes.
Thank you. Dr. Tan, do you want to add to that?
Yes, I'm not sure how old your mother is. I'm not sure what her background is like, but if you're concerned about some of this, sounds like some cognitive symptoms and also some psychological symptoms of dementia, then I recommend getting her to go for a proper assessment for possible cognitive issues so that she can be worked up appropriately.
Thank you, Dr. Tan. So it's 4:30 now. I just want to thank Emily and Dr. Tan for spending this 1.5 hours with us. I think it was a very useful, informative, and inspiring session. We're getting a lot of words of affirmation coming into the chat box, which I will save and then I'll send it over to you, Emily. So thank you very much for being here. I just want to end off today by sharing a bit more about what's happening in terms of dementia care at a larger scale. So I'm going to take just 5 minutes to share this with you all before we close off for the day. So Emily and Dr. Tan have shared a lot on person-centered care, what we can do to manage situations. There are sometimes cases where things go a little bit out of hand though, and generate a bit of stress and distress for caregivers. And that's where I want to share briefly about go-to points and also this application that a number of us are using. And the first thing I want to just tell you about is go-to points. In Singapore, the Agency for Integrated Care and many community partners have set up these go-to points. So that's spelled GOTO points. And there are about 300 of them in Singapore. So go-to points, let me just change the slide. Go-to points are safe return points where members of the public can bring persons with dementia who may appear lost and are unable to identify themselves or their way home. And so what go-to partners can do, they are familiar with the means to identify the person who has been brought to them and will also assist to reunite them with their caregivers. So I've put here on this slide the link to the go-to point directory. You can take a picture or scan the QR code. And so if you ever come across someone who appears to have dementia and appears to be lost and is unable to make their way home, you can actually Google, oh, where's the nearest go-to point to me? It could be a social service agency, it could be a pharmacy, guardian pharmacies have come on board and they can help reunite the person with dementia with their caregiver. So the second thing I want to share, I mentioned, is this app that we're using, and let's see if the PowerPoint will load. There we go. So a number of us are using this Dementia Friends mobile app. We have about 10,000 in Singapore who have downloaded this application. And what it is, it's an app which contains, yes, information on dementia and go-to points, but it helps us to contribute to cases where persons are lost. So let me share a little bit more. So this is the application you can see on the left-hand side. That's what it looks like on my phone. And when you go into it, what you can do, if you are a caregiver and you are caring for someone who has dementia and has gone lost, you can put in information about the person under your care into this application. So this includes a photo, name of the person, what the person was last seen wearing, where the person was last seen, and you can post it on the app. And what happens thereafter is that all people with the app will receive a notification that, oh, a new case has been published. And if you are on the app and you have seen that person, you can go on to the app, lend a helping hand, click on the case and say, oh, okay, I saw this person recently, yesterday at 10:30 at this traffic light junction, or, oh, I'm with this person right now. So that's the app. I wanted to share a newspaper article. I don't have it with me right now, but we've helped about 240 cases in Singapore. So it's pretty inspiring that we've seen stories of this app being used. People being found after having gone lost for a day or more. So what you can do if you're interested is that you can take a picture of this slide or scan the QR code. You can download the application, play with it a little to get familiar with it, and just leave it in the background of your phone. And so that way you can always lend a helping hand if such cases do pop out. So I'm just going to leave this here for just a couple more seconds in case you want to take a picture. And on that note, I will launch this very short poll. We do want to make a survey and see how people are feeling right now in terms of being able to support dementia care efforts in Singapore. So if you could just respond to these 3 short questions, would be grateful to get a better sense of what's happening right now in Singapore and how comfortable people feel. Okay, so I've launched a poll and people are slowly answering. I just want to ask Emily and Dr. Tan, are there any closing words you want to provide for today's session?
Dr. Tan, start first.
Sure. I just want to express my thanks to both of you, Yue Peng and Emily, for being so sporting. And I think this discussion is really timely and wonderful way to raise awareness to the audience. And I'm also really thankful for such a great turnout. So thank you, all of you who are here with us today, for tuning in and spending your precious Saturday afternoon with us. Hope you've learned something useful from our sharing today, and do help us to continue to spread awareness for dementia. Thank you.
Okay.
Thank you, Dr. Tan. Emily?
Yeah. Well, I like to just to thank all of you for making your time here with us, and it means a lot to us also. And that we put in the effort to have this, and there is this beautiful turnout. And what I want to see is that please create the ripple effect. Whatever that you manage to understand or tap out with you, please spread it out and share with your friends. So help us to create a ripple effect of dementia awareness and how to end the stigma. Thank you very much.
Thank you, Emily. So I just want to end off by encouraging everyone to keep learning about dementia and other health conditions, in fact, and to respond with kindness and to accept the changes that are going on around us. So on that note, thank you very much. Please check out our mindfulness programs and the various programs we have. We do have a caregiver network launching in Tampines in November 2020. If you are living in Tampines, that will be when our new Brahm Center opens. But apart from that, we've got wellness activities going on every day at Brahm Center, at McPherson and Simei. So on that note, thank you once again for being here this afternoon. I want to wish all of you a very pleasant afternoon ahead and a great Sunday. Thank you very much. Take care. Bye-bye.